Question 60. Larynx, the location, relations, laryngeal cartilages and the joints of laryngeal cartilages. Here you can see larynx. It connects the pharynx and the trachea. It lies on the level with the 3rd to 6th cervical vertebrae. Here you have the 1st, 2nd. The relations, eventually it has infrahyoid muscles and skin, fascia of the neck and skin. Dorsally it has pharynx, and laterally the lobes of thyroid gland and vessels of neck. Now the laryngeal cartilages, you have thyroid cartilage, cricoid cartilage, arytenoid cartilage, epiglottis, corniculate cartilage, and last one is cuneiform, this one, in the membrane here. Firstly, the thyroid cartilage. It is composed of 2 laminae, separated by superior thyroid notch. Is connected to form laryngeal prominence, and it has superior and inferior cornua or horns. This is anterior view, posterior view, lateral view. Next we have cricoid cartilage. This is superior aspect, posterior, lateral. It consists of an arch and lamina. The lamina bears articular surfaces for thyroid and arytenoid cartilages. So you have for articulation with thyroid cartilage, for articulation with arytenoid cartilage. This was the arch, this is the lamina. Next, epiglottis. This is posterior aspect. It is a thin, elastic cartilage, and the upper enlarged part is called lamina, and the lower narrowed projection is called stalk, and as you can see on the posterior surface it has small pits, and it contains mucus glands in the living person. Now for the arytenoid cartilages. This is medial aspect. They are 2 in number, pyramidal in form, and each has an apex, a base, and a muscular process, and a vocal process. The corniculate cartilages, you can see here, small ones, there are 2 in number, on the apex of the arytenoid cartilage. Here you see the muscular process and the vocal process, muscular vocal, of the arytenoid. And then lastly you have cuneiform, which are placed in aryepiglottic ligaments. So you have 1 on each side. Here you have 1, and on the other side. Now for the joints of the laryngeal cartilages, you have the cricothyroid joint between thyroid and cricoid cartilage. and the lamina of cricoid cartilage articulates with inferior horns of thyroid cartilage. And then you have cricoarytenoid synovial joint. Lamina of cricoid cartilage articulates with base of arytenoid. You can see the movement. Now lastly, the ligaments of the larynx. You have intrinsic ligaments and extrinsic ligaments. Here you see intrinsic ligaments. This is called the arioepiglottic membrane, a ligament, and it has several parts. Firstly, you have upper part and then lower part. The upper part is called quadrangular membrane with a vestibular ligament in the inferior part. And then the inferior part is called conus elasticus or cricothyroid membrane, and upper border is vocal ligament. Now for extrinsic ligaments, you have thyrohyoid membrane, goes between the thyroid cartilage and the hyoid bone. You have middle thyroid ligament, lateral thyroid ligament, and this membrane is perforated by superior laryngeal nerves and vessels. Then you have a hyoepiglottic ligament that goes between the hyoid bone and the epiglottis, and you have a cricotracheal ligament that goes between cricoid cartilage and the upper or the first tracheal cartilage. And in this last picture you can see hyoepiglottic ligament.